today. So Jordan, we're going to address some of the stuff that's been going on with your knee. So we're 5 weeks post-injury of your patellar subluxation. So today, based on my assessment, we're going to try to decrease some of your pain that you've been having. We're going to try to decrease some of that residual swelling that still exists in and around the joint. We're going to try to increase your range of motion because you do still have limited flexion. We're going to try to increase some of the strength because you have lost quite a bit of muscle mass in that side in comparison to your non-affected leg. We're going to have a discussion on some of the goals that you'd like to make for returning to play because your tryouts are coming up in July. Is that correct?
Yes, it is.
So we'll have a discussion about that and make some realistic goals to try to get you back into play as soon as possible. Today we're going to address the joint above and below kinetic chain with some posture and core stability exercises. We'll also work on your balance and proprioception. Along with that, we'll do slight sport-specific stuff. Because you're a goalie, we're going to do some catching and throwing, incorporating that into the proprioceptive exercise. We're going to have you wear that knee brace during all of the activities and anytime outside the clinic that you're doing activity. I'm going to give you some exercises that you can use at home to make sure you're progressing when you're not in the clinic.
All right.
Do you have any questions?
No.
Alrighty, let's get started. So first one we're going to do, I'll just demo it really quick. So we've been working on single or double leg semi-squats. So same thing's going to apply for today, but we're going to do single leg. So where we have, we engage our TAs, our knees bend, our butt goes back, we sit into that chair, and we're only going to go semi-squat position. We're going to increase the difficulty and get some proprioception going with this, doing single leg. So basically all I want you to do, same thing, core engages, knee bends, hip hinge, butt sits back, 3/4 length, and then come back up. Okay. If you have to touch the ground, that's okay.
Am I doing that on the foam pad?
Yeah, you're doing that on the... Oh, actually, sorry, I lied. We're going to do that on the ground first, and then if that's too easy, we'll progress.
Oh, okay.
So this will be for strength.
All right.
So get your balance, engage your core, bend the knee, and come back up, and squeeze the glute at the end. Good. Do you have any pain with that?
No.
No. Okay, good. So we'll do 3 sets of 10 for that, and if that's too easy, we would do that on the foam pad. But the whole part of this is that we're going to try to increase some of the strength in your quad doing that.
Okay.
Okay?
Yep.
Next one we'll use the pad, and this one's going to be for proprioception. So what I'm going to have you do is in that same single leg stance position, I'm going to have your knees slightly bent, core is going to be engaged, and I'm going to be passing the ball back and forth to you. Like I said before, we're going to try to increase a little bit of that sport-specific activities while doing proprioceptive exercises. How do you want to stand here? You can go on that side. All right, so get your balance, nice engaged quad, and we'll just do a couple passes. Good. So this is trying to get you back into doing some sport-specific stuff as well as proprioception and balance. And we'll do this kind of 10-15 times until you start to kind of get fatigued. And you can do this at home as well by throwing it against the wall. Okay?
What do I stand on at home?
You can stand on a pillow or a rolled up towel or anything like that.
Oh, okay, cool.
All right? Got any questions?
Nope, sounds good.
All right.